I'm Rosemary Calder, and I'm a Professor of Health Policy at the Mitchell Institute in Victoria University. Our focus is on preventing poor health and education outcomes in Australia, and we particularly focus, therefore, on disadvantage and place-based approaches. The work we've been doing for some time now is highlighting the risk factors for poor health and preventable chronic disease that exist in the population. So we have been identifying weight, overweight, physical inactivity, poor diet and nutrition as very significant risk factors for many preventable chronic diseases. They are also, of course, risk factors for infectious diseases, and that's particularly significant in 2020. It's really important that people understand that what we eat and how physically active we are creates our bodies, enables our bodies to be healthy or to be unhealthy. We know how hard it is when people are on limited incomes to be able to afford fresh food and to be able to afford what's become the norm in our modern society of going to a gym or owning a bicycle and wearing a lot of lycra. For people with very few resources, that's completely unattainable. So what we need to achieve is community-wide understanding that we're all better off if we can change our diets and increase our physical activity and be careful of sugar and salt in processed foods. But that's a very hard thing. So that's why we focus on how do you work in communities that are commonly more disadvantaged than others. How do you help people through their communities develop an understanding of the need for their children's health to be protected and the need for their own health to be improved. We've learnt through 2020 that health experts who can provide advice to decision makers as a collaborative effort, who can look at the evidence and provide advice that is based on evidence but for policy implementation. We've learnt that that works. And as a collaborative, that's what we can do. We are available as the experts across a range of disciplines in a range of ways to help decision makers, governments, health services understand how complex weight gain in the community is, how much of a risk obesity is for many outcomes, including premature death. So we need to bring all the experts together. We need to bring them together with decision makers. And as a collaborative, we've achieved the first and we will be available to undertake the second.